young woman, and you guys are all health professionals, so I don't need to tell you this, but I'm kind of saying it for my own sake, too. Thinking back about all the stuff I did tell you just an hour ago, I just, want to say that I feel like a doctor-patient relationship and confidentiality is respected. I'm in this hospital, which has always respected me, and in this room, and I just want to say that I'm really thankful to MacKenzie's parents for giving us permission to interview her on stage about a very personal subject. And I want to really thank MacKenzie for sharing her story with us before we start, and say that I have promised MacKenzie and her parents that her story and she is safe here today. And I know that's true, but I wanted to say it out loud so that everyone could hear it, especially you. MacKenzie, can you tell me how old you were when you first got your period?
I was 12.
Okay. And can you tell me how long after you got your first period did you start to have pain, discomfort, or any of the other symptoms? And please describe those symptoms.
Probably at like the year mark. For the first year or so, within 3 months, I was pretty regular and everything was fine, and I couldn't figure out what all these women were complaining about. And then after that, it was just getting progressively worse and worse every month, and I was miserable. Like, I would sit there and I would cry because everything hurt so bad, and I was physically ill because food would make me sick. I didn't want to eat, but I was still hungry. I got really bad headaches. It was horrible.
I'm going to swap seats with you because of your bangs. I want them to see your face. Be mad at myself if I didn't do that. There we go. It's such a beautiful face. We want to see it. Okay. And when you say everything hurt, can you be specific?
I mean, like, I had really bad the cramp part of it, but aside from that, my whole body just ached. My back was killing me. My neck would ache. It felt like if you do a whole bunch of exercise after going a year without exercising at all, that's pretty much how I felt. It really hurt everywhere, like my arms, everything.
And how was your menstrual flow? I mean, it's hard to compare it if, that's all the period you've ever had, but can you describe that to me?
It got a lot heavier, really, really heavy. I went from, just using a pad of like 2 or 3 pads a day to bleeding through these super big tampons and having to change them every 2 hours.
I actually couldn't use tampons for many years because even that hurt. How did you arrive at using Tampax?
Actually, because of gym, we had a swimming unit, and apparently having your period wasn't a good excuse not to swim.
Ah. Okay. And how long was the duration of your cycle, typically, after that 1 year mark?
It would last anywhere from 3 days to 17 days. It was not, some months I'd have it and it'd only be for a few days at a time. And then I remember this one time really specifically because it was the worst. I bled for 3 weeks.
So did you miss school, or were you going to school during this time?
I still tried to go to school, but I ended up having to come home more often than not, and I didn't want to be there. I felt terrible. So I was constantly asking to stay home, and then with Mom, I'd be, well, just try to get through the day. And then by 10 o'clock, I'd be, okay, come get me now. I can't do this anymore.
And, I went to school a long time ago, but when I went to school, you would go to the nurse's office and you would say you didn't feel well, and they would have to call your mom or your dad, and they would come and pick you up. Is that the similar process you went through to go home?
Yeah, well, my school's big thing was if you don't have a fever, you can probably be at school. But since I didn't have a fever most of the time, I would they'd be like, all right, well, why don't you just lay down for a little while and see how you feel after that, and then, you know, if you still feel terrible, we'll call and see if it's okay with your parents. So I'd lay down with the heating pad, and nothing would give because the schools obviously can't give you Tylenol or anything. So there was nothing to help. So it was 20 minutes, and then it was 40 minutes, and then it was an hour. And finally I was like, can I just leave? I'm not leaving your office today. So they would call my mom. She asked to go home again. My mom pretty much knew the deal already, so.
Okay. And if you were missing school, whether you came home partially, you know, after a partial day, or whether you stayed home sick, how many days would you say in a typical month would you miss school?
It's really hard to say because some months I would get it and some months I wouldn't. So, you know, on a month where I got it, including like all the time from me just leaving early, I'd probably miss about 5 days. Like, that's rounding all the time that I left early for doctor's appointments and stuff within just staying home.
That's 25% of her school days missed. A quarter of no math, no history, no art, no sports certainly, but, you know, all of the things that we want for our children, right? And yet you are still expected, of course, to get the same grades as everyone else who's in school 100% of the time. You clearly must have started to see a pattern. I mean, you know, it's easy to see, oh, my period's coming, I'm going to have this pain. Can you describe, or do you remember the first time that you spoke to someone about the possibility of something not being right?
Yeah, I was talking to my mom, and you know, she just asked me how I was feeling, and I said, Mom, this isn't okay. This isn't what it's supposed to be. I mean, I'm no expert, but I'm pretty sure that I'm not supposed to be crying because I'm in that much pain. So we made an appointment with my
Pediatrician?
Yeah, that.
It's okay. He couldn't say some words.
I
And
can't.
he has a PhD, so don't worry.
That's a difficult word to say.
Yeah.
But we went in there, and it was, okay, well, let's run some tests. Let's do a blood test. Let's make sure you're not, like, anemic or anything, and put you on vitamins. So I was taking some vitamins, and, you know, all my tests came back. Nothing abnormal. So we just kind of kept going along until the next time came, and it was the same thing all over again. Only I can remember my freshman year specifically, I was in so much pain I fainted in the middle of class.
Clearly a drama queen. I think you are pretty much an expert because pain is your body's way of telling you something is wrong. And after you're in pain for a long time, you become very well versed at it and the signs of its onslaught. And, you know, so did your mother take you to a doctor, or did you speak to any health professional other than the pediatrician, like, you know, a school nurse, like your school nurse? Your school must have been like, why are you keeping on coming here and going home?
They know me on a first-name basis there. Oh, hey, what's up? You're here again. Yeah, they knew pretty well. For a long time, it was, you're here again, what's wrong this time? Oh, same thing? Go lay down. It's that kind of thing.
It's interesting when you describe the reaction of the school nurse, I'm assuming. Is it a woman? Was it? Okay. So it sounds almost kind of pat. It sounds almost like, oh, here's the routine.
Yeah, that's exactly what it was. Because, I mean, I'm sure they get it all the time. There's always going to be a girl trying to milk it for what it's worth. But I was there, and I was actually feeling this terrible, and it was just, well, okay, here we go again, that kind of thing.
I mean, when I was in school, I remember the admissions office, you had to have a note when you went back the next day, right? A sick note about, please excuse my daughter, she has a fever, or she, whatever. has a cold. I mean, your mother must have been writing a lot of notes. And did your mother state the reason for your absence? Did she say, abdominal cramps or period or menses or?
I wouldn't let her. That wasn't something I felt like needed to be advertised to anybody. But it just kind of came to the point where it was expected. We kind of just stopped writing notes.
Really?
Kind of got old after a while, so.
But nobody raised an eyebrow at school? Like no one said, there's a few things I want to address, and I don't want to forget to address them all in this little statement that you just said. So when you went to the nurse's office, did you say you didn't want your mom to write the note that said you had menstrual cramps? So when you went to the nurse's office, did you say, I have my period and I think that's why I'm hurting?
Yes.
And since you were on a first-name basis with this nurse, did you say, I have my period again? I mean, she could have looked on her calendar and expected you next October 15th, and then November 14th, and you know what I mean?
That's kind of what you would think should have happened, but even though it'd be like, all right, it's that time again, no flag was raised with the irregularity of me coming in. I was coming in like every 2 weeks. For multiple days at a time. It wasn't just once every 2 weeks. It was like 3 days in a row, every 2 weeks, or every 3 weeks, or within a week.
And this nurse or no one else who worked in the attendance office said, why are you missing so much school, or something is wrong, or this doesn't seem right because I see you more than your other peers?
No, nothing was really said, and I think it's partially because it's probably just assumed that there's got to be something going on if my mom's willing to take me out of school that much, and I don't know, maybe they think it's not their place to say something, or if, they just kind of assumed I was, for lack of a better term, a problem child who I have issues at home, and maybe that's what was going on. Mm-hmm. But it definitely wasn't like, nobody blatantly asked me, why are you never here? Or why are you always here?
And what about your girlfriends? I mean, you must have classmates who are also going through puberty and have their period. And did you talk to any of your girlfriends or your gym teacher? You say you were mandatory swimming even if you had your period. Did you talk to anybody else or a counselor? I
talked to my friends, and a lot of them got their periods later, so they're excited about growing up. And I can just remember at one point I was talking to my friend and her mom, and she was all excited about getting her first period, and I was like, don't be, it's the worst thing you'll ever experience in your life. And it was pretty different because she'd already, this is her third time with it, and she's like, what do you mean? I don't understand what you're talking about. I mean, yeah, it's uncomfortable, but it's not anything that, would be something to cry over. And I was like, no, it's something to cry over. You could definitely cry over that pretty easily. I do it all the time. And I think that was when it was like, oh, okay, maybe I actually am different, and I have some, something going on that most people don't.
Yeah, for most people, it's not that big of a deal, right?
Well, especially, I have 6 sisters.
Ah.
So I remember one time, my one sister, I was crying. I was in so much pain, and we were in PetSmart at the time. And my sister's just just suck it up and get over it. We all had to go through this.
Yeah, I heard that a lot from people who didn't have.
She didn't really understand.
So I'm just curious, do any of your other siblings have symptoms? Because it is, a greater chance if your relatives have it.
No, my sisters don't. My mom does. But, yeah.
We'll get to that in a minute. Lucky them.
Lucky them is right.
So it's interesting that when you went to the nurse's office, you did, in the privacy of the nurse's office, where it was just the two of you, you did say, I have my period again, or I'm bleeding again, or I have, stomach cramps again, whatever else you may have said or not. And none of those times did someone say, maybe you should go to a doctor?
No. I think it was something with your period, I feel like for the nurse and student relationship, maybe it's very hard to say because it is a personal thing. Nobody wants to like talk about their period with their school nurse, so it's not very, that's kind of an awkward situation. So I would imagine it was something like, well, you know, that's your business, you deal with that on your own, but at the same time, I needed help.
Does your high school have any sex education that you guys went through?
I had to go through that in middle school, not in high school. So
Okay.
It was like before all that.
And when you were learning about your body, along with your other classmates, and how you get your period and the ovaries, I remember the drawing, much nicer than Sechkin's. But did you ever hear the words endometriosis?
Never heard of it.
Okay. I mean, one of the things that the EFA would like to do is to implement changes to the way sex education is taught in schools in this country and beyond, so that when both young men and young women, or kids, actually middle school, they're still children, are learning about their bodies, they learn also about the possibility of this condition existing in one of, in their body. So that way it becomes a normal thing. It's not something you learn about once you have the problem, that you're just made aware of it, like you're made aware of STDs or birth control or anything else relating to reproduction. And we would like for both young girls and young boys to learn about it, so that even if you're a boy, and maybe your sister has it, that you are compassionate and you can help. And so even if your sister hasn't gone to the same school and heard the same speech, maybe you can say, hey, Mom, I heard about this thing. Maybe Lisa has it. But then when you ask your mother to write these notes, she's writing you the notes. What does she write on the notes?
Just that I didn't feel well, that I was sick. That pretty generic, cliched kind of note.
Please excuse MacKenzie, she was having a bad day.
No, never that generic, but more like, please excuse MacKenzie, she was bedridden and ill.
Okay, all right. Well, bedridden's pretty ill, right? So, and at what point did your mother tell you you would have cramps? Like my mother told me, expect cramps. Some women have it, some women don't. Did your mother have a similar discussion?
Yeah. When I first got my period, I knew it was to be expected, having 6 older sisters who already went through it. So I pretty much knew all of that already. So I knew cramps were to be expected, but Mom caught on really quick that these weren't cramps. They were a lot more than cramps.
Okay. At what point did you meet Dr. Regard?
March of my freshman year of high school.
You're a senior now?
I'm a senior now, yeah.
Okay.
My pediatrician sent me to her to kind of figure things out because they were at a loss. They didn't know what to do. And it was just, I was going into high school, it was time anyway.
Right. And can you please describe your first consultation with Dr. Regard?
It was, I don't really know how to explain it. It was like, okay, so you're going through this, this, and this. Let's see what we can do. So within my first consultation, she'd had me for tests, and I was, trying out new things to try to manage the pain. And the term endometriosis had come up. It wasn't definite. We hadn't really talked about it in depth, but it was a possibility. Mm-hmm. So
that's all we ask. The issue be at least raised. Hopefully before you get to somebody like a Dr. Regard, hopefully soon after you're missing school.
I want it noted, she was awesome.
Thank you.
Just saying.
Thank you, Dr. Regard. And so then what happened?
I came back to her, I think 3 months later, and things weren't getting worse. They weren't getting better. They weren't really getting worse either. They just kind of stayed the same. So I don't even remember what it was, but she had me on some kind of treatment or something to make it better.
Long words, yeah. We heard them this morning.
I don't remember. And that wasn't helping. It was actually by the second visit with her, after that, things had gotten worse. So I think I went back either 3 or 6 months later, and it was is, okay, we think you have endometriosis for sure this time, let's go on the pill. So I started treating it that way, and I went for more tests.
And how long did those tests take? Like, how long before how long were you on the birth control? What was you said 3 or 6 months, but I want to know.
Yeah, I don't remember exactly how long, but I had been on the pill for, like, from that point on up until my surgery.
And when was your surgery?
Last December.
Okay. And so that's a long time. That's like a couple years, right?
Something like that. Like, at first, when I first went on the pill, things were getting better, and then they weren't anymore. Like, it wasn't...
Stopped working?
It stopped working. So then she put me on a different regimen, and that worked for a while, and it stopped working. And then we talked about surgery, but I didn't really want to do that. Inconvenient. And then finally I was like...
Well, also it's surgery, you know? Anesthesia, needles, right?
Yeah, I'm not really fond of sharp objects. So,
yeah, me neither, yeah.
But finally, it was September of last year, and I was like, all right, I just can't do this anymore. So we called Dr. Gard. I'm like, it's time. Let's pick a date. So I went into her office like a week later, and we figured out when we were going to do my surgery.
And I'm just curious, you say that when you went on these medications that things did improve for a while. So, you know, did you pass the nurse in the hall from school? Did you say, hey, where you been?
Well, it wasn't quite like that. It was like they would improve, but not exactly to the point where I should have been. Okay. So I would still be missing school, not as much as I was before I went on the pill, but enough to still be like, it's still not exactly right.
And you know when your body's right or not right, when it feels right. You know, that's a subjective thing, but you're in your skin. You know when you feel good, you know when things are quote-unquote normal, right? I'm just curious about your other teachers, your math teacher, your English teacher, your history teacher. Did any of those teachers say, why are you missing so much school, MacKenzie?
No. Nobody really asked me because it was like, yeah, I was missing a lot of school, but I would make sure I had my work in. So it wasn't really a super big issue. Mm-hmm. I mean, my grades could have been better, sure, but it's not like I was failing anything.
Okay, good. I just want to talk briefly about how you feel now that you've had your surgery.
So much better. So much better. I can actually go to school now and live normally. I can do things. I don't have to, constantly worry about being in pain while I'm doing things. 'Cause I do a lot, put too much on my plate on purpose. And so now I can actually get through that without having to stop and say, all right, I don't feel good, let's go lay down.
I used to think I had a really low threshold for pain. It turns out I have a really high threshold for pain. And I think you realize that after you have the surgery as a patient. You don't really know until you look back. I wanted to ask you about your mom, because there's an interesting third act here to the story. Can you talk a little bit about your mother's gynecology?
That's not something I hear every day.
Yes, it's not something I say every day. But we have your mother's permission, so.
Well, my mom, her gynecologist that she had been to for years and years, I'm only finding out about this now as time goes on. But I guess my mom had a lot of similar pains, and her gynecologist was all like, oh, it's probably just a cyst, you're fine. Never really looked in depth into it. And then about a month after my surgery, my mom was in for the same surgery. They took a whole bunch of endo out of her as well. We're twins now.
Well, we're glad that a whole bunch of endo was taken out of both of you. And finally, before we finish, is there anything I haven't covered, or is there anything that you would like to go back and say to that school nurse? If you have, then that's fine. But what would you say to all these school nurses?
The symptoms, they're horrible enough to begin with, but the isolation that came with it from, you know people think you're faking. Whether they say it or not, there's always that insinuation. There's always that undertone. And that, for me, made for a very horrible 3 years of my life. Because I knew everybody thought I was making it up. And I became very depressed by it. And it changed me in a way that was not good. So if any young girl can be, saved from that, then save her. Even if it's like just a question, like, do you feel okay? Have you seen somebody about it? That can help a whole lot, as opposed to, why are you here again?
I mean, puberty is hard enough without this layer on top of it. So.
Exactly.
And can you talk about that a little bit, like the isolation and the loneliness? Because we spoke on the phone in preparation, and you talked extensively about that.
Even my pediatrician had given my mom a list of names of therapists she thought could help benefit me, because she wasn't entirely convinced things were as bad as I said they were. I mean, I can't blame her. 2.5 years of not finding anything was really hard on all of us. And I still have a very personal relationship with my pediatrician. She's my dance teacher. I see her every week. But it was, even from that, like, my family, well, my mom aside, my mom was on my team from the beginning, but even like having my sister just say to me, suck it up, stop exaggerating, you're fine, was so hard. My dad didn't know what was going on. Not my stepdad, that's my stepdad. He's really nice. He's cool too. I need to clarify that. But even my dad was like, well, if they're not finding anything, then there must not be something there, and that wasn't the case at all. So, when I was in pain, I didn't want to come out of my room, because I didn't want to have to face everybody saying, oh, well, you're fine, get over it. So my room kind of became my cave. The door stayed closed a lot of the times, and I became very, very withdrawn from everybody and everything. I, took to hiding out in my room instead of talking about it. And it was very hard, because I knew I could have gone to my mom anytime I needed to, but I didn't want to burden her with it either. So I was very, I guess the only word I can think of is withdrawn, and where most teenagers should be going out on Friday nights and having fun, I just wanted to stay in my room where nobody could accuse me of faking or being overdramatic, which is what I heard a lot. And I spent more nights crying than I did doing homework. That was when it became really evident that something really needs to change, because that's not okay either. When I can't get through a day without actually just sitting there and crying for 20 minutes, then something's wrong. And nobody alone should have to go through that, let alone a girl who's going through probably high school, which I think we can all agree will be the most difficult point in anybody's life.
Also the most fun. It gets harder after. There is this. Sorry to burst your bubble, but it's fun in college. College is really fun. But there is this sense of hopelessness as well as a sense of embarrassment, because your period's not going anywhere, right? It comes back right around after a month, and a lot of young girls that I speak to talk about that. And so I understand the not wanting your mom to put the specific reason why. I want to thank you for sharing your story so openly. I want to thank both of your parents for bringing you here and giving us permission to talk to you. I sincerely hope that you too will be one of our soldiers and our messengers to other young girls who may have not been fortunate enough to find a Dr. Regard in her life or a Dr. Suchkin in mine, and maybe not fortunate enough to be one of the students of these nurses who are here today. So thank you so much, MacKenzie. We wish you luck. We look forward to seeing you grow and blossom.
Thank you.
Does anyone have any